suffer a life-threatening injury, your chances of survival are changing.
There's a revolution going on right now across the United Kingdom in the way that we treat patients with major trauma.
There's like a head-on collision, so people still trapped in the cars.
There's not a lot left of that vehicle.
In the past, hundreds of patients have died who might otherwise have survived had there been a more effective chain of survival.
Adam Brooks Major Trauma Centre. I think she's triage tool positive under pelvic fracture.
OK, has she had pain relief?
Now, across the country, a new coordinated system is triggered by the most critical injuries.
Going straight down. Lovely. Kate is your team leader.
Medics with advanced life-saving skills rush to the scene.
Can we take over the leadership?
A well-drilled emergency department prepares.
Pupils are not reactive.
The latest technology is waiting,
So I want this patient through the scanner as quickly as possible.
and specialist surgeons stand by.
The clock is ticking.
The BBC has followed the first regional major trauma network to be fully operational, based at Adam Brooks Hospital in Cambridge.
This is the front line of emergency medicine.
Just don't keep anything from me.
We have people who arrive at the very limits of life.
I just thought she'd gone at that point.
OK, stand clear. Shock in.
If you suffer a critical injury, these are the men and women with the best chance of saving your life.
Hello, Adam Brooks ED.
It's 5 o'clock on a Saturday afternoon at Adam Brooks Hospital.
Bacon.
Oh, killer.
Can you get Brendan to print out some more pre-alert forms for there, please?
So far today, the doctors and nurses in the emergency department have seen 174 ill and injured patients.
Anna, have you got any anaesthetic drugs out?
Adam Brooks Emergency Department.
Consultant Rod Mackenzie has just come on shift.
All right, thank you.
He's in charge of getting the hospital's new major trauma system ready for life-threatening injuries from across the east of England.
Okay, just take it away, mate. So you're going to have a few stitches in there.
You OK there?
What's the address of the emergency?
At 10 minutes past 5, Ambulance Central Control receives a call that triggers the new system.
There's like a head-on collision. There's just two cars, one's in the middle of the road, one's on the side of the road, so people still trapped in the cars.
4 still trapped. All right, thank you, bye. The maximum number of simultaneous major trauma patients that we've planned to see at any one time is 5. 4 or 5 patients requiring resuscitation at the same time would push us. So there are 4 patients in total. They've been trapped for a long time.
It's Neil here from Cambridge.
The first response is to send an emergency medical team to the accident, 30 miles north of Cambridge.
So, cheers, Dave. Bye-bye.
Patients still trapped. We've got a variation of chest, pelvic and femur injuries. 2 men and 2 women.
CCD Medicaid aid, that's all received. Thank you so much.
Dr. Auden Langheller and critical care paramedic Neil Flowers are specially trained to handle the worst incidents.
Being able to deploy a medical team to these incidents is really important because it takes essentially elements of the hospital care to the patient.
If there are 4 poorly patients on scene, it's probably going to be quite chaotic. It's going to be a difficult scene to manage, and there's going to be a lot of decisions that are going to need to be made.
This is the east of England. Stretches from the M25 up to the Wash, across to the east to Great Yarmouth and the coast, across to the Midlands and the M1 corridor. 20,000 square kilometres, 5.8 million population.
So nearest trauma centre is Adam Brooks. Nearest hospital is Peterborough, which is a district general hospital. So we just have to bear these things in mind.
So in the past, each hospital would work effectively in isolation. In the new system, we're trying to get these patients to the major trauma centre in Cambridge.
It's likely, from what the initial reports we've got, that these are patients who are going to have multiple injuries. These are going to be very poorly patients.
It could be a life-threatening injury.
It's an hour since the collision took place.
Medic 88 on scene.
There are already 40 firefighters, 6 ambulance crews and the police on scene. But they need Neil and Audun's advanced medical skills to help free the trapped patients.
Right, I'm seeing Commander at the moment.
There's one patient here.
One patient there,
Yeah.
and 3 patients over there, all trapped. All P1s at the moment. We have someone over there with no blood pressure and reduced air entry.
The Peugeot here, this vehicle's got a single occupant in it. The Astra, which is in the hedge, has got a family in it with mum and dad and daughter. Daughter in the rear is quite ill.
The 2 cars were travelling in opposite directions and have hit head-on.
Hi guys. The guy in the car there, again, it's a 30-year-old guy, completely awake, GCS15, appears to have a good chest, but again, pelvis and femurs.
Okay, open.
The man driving alone has told medics he's called Matthew. He was driving to his girlfriend's. The family of 3, the Davises, were on their way to a local concert.
We want your guys coordinating, literally hands on, nice and big and strong, hammer out. We're along board. This one, yeah? Yeah, no messing around.
Neil and Audun see that the daughter is wedged between the front seats, trapping her parents.
There's a patient in the back of the car. She has a femoral, a right-sided thigh fracture. We need to just get her pain under control.
Neil suspects her leg was broken when the impact forced her into the seats in front.
This is ketamine. It's a big dose of ketamine. We're unable to get IV access on this lady, so we're going to give her an intramuscular injection.
Lift, 1, 2, 3, lift. Down!
An hour and 20 minutes after the collision, the fire crew lift Dawn, the daughter, clear.
Move up, move along into that.
That's it. Lovely job. Right, put them up.
Another emergency medical team have got Matthew out of his car and are assessing him.
This patient sustained some quite nasty lower leg injuries, giving him a pre-hospital sedation. We've managed his fractures, and we're now going to go to Addenbrooke's as the major trauma centre.
The team's worried that as well as his leg, he's broken his pelvis too.
Hello. He's got an open femur and you're worried about his pelvis. Okay, that's fine. Bye. That's the first one. Diego, your patient. 30-year-old male. He's got a quadripelvic fracture, right open femur. He was awake, but he was sedated for the extrication.
Which nursing staff are a part of this? You're going to stick with this bay?
Okay. We know that the first patient will be arriving in the next few minutes, and you can see that we've created a number of different teams with one kind of overarching team leader, myself, to coordinate what needs to happen.
Critical care paramedic Gemma Varela assesses Dawn. Now she's out of the car.
At the moment, the patient looks like she's got a nasty isolated femur fracture and possibly a pelvis. So we've managed to give her some drugs to help with the pain, and we're just going to take her straight to the major trauma centre.
Now Dawn's on her way to Addenbrooke's. Neil and Audun's priority is her parents, still trapped in the car.
Any update, Jem? Well, to get patients out, they're in a bit of pain, we need to give them something for the pain. So we're just trying to speed that up so that we can speed up getting the patients out so we can fully assess them.
An hour and a half after the accident, the team lift Teresa, the mother, clear from the passenger seat.
You will be with an ambulance shortly, okay?
Finally, they free the father, John.
Is this bearable? Yeah. Pain your tummy? Yeah.
As soon as Neil and Audun are clear there's no immediate threat to life, both patients can be moved on.
Can we get inside an ambulance?
Yeah, okay.
Because this is too noisy.
Do you still think about Addenbrooke's?
Yeah.
Please, yeah, Addenbrooke's.
Yeah,
Okay,
Addenbrooke's.
no worries.
first of the ambulances arrives at the major trauma centre with Matthew, the single driver. He's 36 years old.
Ready, brace, move.
Everyone happy then? Approximately 5:30, so 2 hours ago this evening, he was involved in a road traffic collision head-on. He was the driver of one vehicle and was trapped for over an hour. Injuries top to toe. He's got some cracked teeth, some blood from his mouth, but no airway issues. Query pelvis, angulated open right femur, and that's us.
I'm just going to get all this off you, mate. Lots of people all about, sweetheart.
In each bay, you'll see there's an emergency physician who's the team leader. Then there are 2 nursing staff, and then in each team there is an airway doctor, and then someone else, a runner if you like, to support them. So a minimum of 6 people in each bay.
I'm just going to borrow this arm. Just put a pressure cuff on. Wow.
The trauma team rapidly assesses Matthew for life-threatening injuries beyond his broken leg.
Ask the radiologist to run off, so the patient's stable for CT.
At the moment, yes.
Yeah, let's get him packaged, let's get him around CT.
Okay, definitively he's got right femur fracture with quitting pelvic fracture. That's why we're doing the CT.
That patient's been here 17 minutes now, so I want this patient through the scanner as quickly as possible.
The system's designed to get patients to CT as fast as possible.
We really worry about pelvic fractures because there are big veins that travel through the back of the pelvis that can be disrupted, and there can be torrential bleeding inside the body in a patient with a pelvic fracture that we can't see, so we need to get to CT very quickly to do that.
The CT's a rotating X-ray scanner. In minutes, the doctors will have a full 3D map of the body to spot any internal injuries. Ten minutes later, the second ambulance arrives with the daughter from the family, Dawn.
Oh, you're in Edinburgh Hospital in Cambridge. So there's an IV. Matthew, is there anyone we need to let know?
Ow!
In the thigh or below the knee?
Oh! Ouch!
Remember, try and keep this arm still.
Can we also get some ketamine, please? So again, 100 milligrams in a 10 ml syringe.
Ow! Sorry.
The emergency medical team fitted a traction splint at scene to pull the 2 pieces of the thigh bone apart.
Look at the fracture, so she's getting muscle spasms. And these spasms.
But Rod thinks Dawn's pain is due to the splint coming loose.
I want you to reposition the top straps. Just undo them, make sure in the right position, and I will reposition the ankle halter.
I'm going to try and adjust this splint to see if we can get it to hold your leg better. Really well.
So, toe, knee, and to superior iliac spine.
Yep.
Look at that position compared to what it was earlier on.
Yeah.
So it's a much more comfortable position for her.
Do you want me to put the catheter first?
And 3 hours after the collision, an emergency medical team bring in John, Dawn's father.
Kate is your team leader.
Ready, set, move. Okay, I'll go up this end. Hand over.
So from the top, airway is fine, trachea is central. We've got visible contusions to the abdominal wall and to both iliac crests. So we're suspecting chest, abdomen and pelvic injuries. Okay?
If he's stable, let's go to CT. Yeah.
Okay, you happy with that?
With 3 seriously injured patients already and another on the way, Rod's system is being pushed close to capacity.
Do I get water ready? Yep. Everything ready?
When will patient 4 leave scene? Patient 4 could be 20 to 30 minutes before they leave scene, over.
Neil and Auden have been delayed at scene.
They're now going to start playing. I'll be giving regular 10 minutes of
Their final patient, Teresa, has become too ill to be driven to Addenbrooke's.
DCS? Yeah. Okay, so indication is for head injury and... Head injury, fall and DCS. Yeah. And chest injury is not ventilated.
1, 2, 3, slide.
They've discovered the impact has broken Teresa's ribs, which have punctured her lungs.
Have we got blood pressure?
140 and 107.
Okay, yeah, I'm happy with that.
Her oxygen levels are dropping fast, and her life is in serious danger.
Now just check the sats. Crack that suction open so I'm ready to go. Leave it on there. Just stretch across.
Neil and Auden are trained in the technique that could save her, putting a tube down her throat to push air into her damaged lungs.
So that's 3 of fentanyl, so that's 3 micrograms per kilo, 8 threes are 24, 240 micrograms, correct, 5 mils, yeah? Want to burp?
Thank you, that's fine. Thank you, lovely, lovely. Boost it down.
So seeing chest rise.
Nice air entry on the right side. It's also on the left side, but it's lower. Okay, so it's
But after the procedure, there's a new problem. Air is being forced out of the holes in her lungs into her chest cavity, causing her left lung to collapse. Her oxygen levels are falling lower still.
I'm just going to do a thoracostomy, which is basically putting a small hole inside her chest.
Neil wants to make a cut between her ribs to release the trapped air.
I think that, for the gross area check, hand in there, I think that is the 4th or the 5th. Would you agree?
Yeah.
Yeah.
Something like that.
Okay, the left lung is up.
Left lung is up.
Don't feel any rib fractures. Okay, so that's good.
With the pressure in her chest released, Teresa's lung has reinflated.
We're good to go. Just go nice and steady. Obviously lights on, but steady. And just get us through the traffic, okay?
As far as I know, the pelvis is just on the
Hello, this is Dr. Langhelle from the East Anglian Air Ambulance. The patient is anaesthetised, intubated, ventilated.
Yeah.
ETA is 15 minutes.
Thank you.
Yeah, fluids have kept the normal saline.
Frank said they'll be here in 15 minutes.
General surgery and orthopaedics, they're hovering in the middle.
Yeah.
SATs came on. Okay, can you work on that?
Just 5 miles out from Addenbrooke's, Auden and Neil see Teresa's oxygen levels are dropping again.
Right, where are we? Turning right. In terms of from Addenbrooke's?
No, it's harder.
Okay, so it's getting harder, sats are dropping, head tidal's not great. Let's just refinger that thoracostomy. The only thing we need to get this sorted out.
There's still too much pressure in her chest. Neil attempts to reopen the hole in her chest wall.
Find out where the bloody hole is.
SAT's increasing.
Okay, good. Ready? Across.
Teresa arrives in a highly critical condition.
We need to sometimes be very aggressive in the way that we resuscitate someone, and I mean that word deliberately. We really need to attack the patient who's sick when they arrive.
So on slide, ready, set, slide. Play on my side.
Okay, lovely.
Pupils are not reactive. Not reactive.
Not reactive.
Equal, both of them not reactive.
You just carry on focusing on the patient and we'll work around you.
Right, John, chest drains on. We're putting chest drain on the other side now, yeah?
Yeah.
It's the turn of Rod's trauma team to try and release the pressure from Teresa's chest and stop her oxygen levels falling further still.
All right, so let's make sure both sides of her chest are decompressed.
They've made a second hole between her ribs.
And was that lung up on that side?
Chest now, and no blood, and the lung is up on my finger.
Great.
With the pressure released, her lungs have reinflated.
Is she ventilating well?
She's ventilating fine, and John can feel the lung is up under his finger. Okay.
Teresa's out of immediate danger.
The arm keeps moving, it's struggling to get a reading, but everything is fine.
Her 2 sons and daughter-in-law have been waiting to see her.
John actually called us from the car. He didn't know how bad it was, but he was very calm. We're still waiting to hear on Mum. Basically, we were told just to be prepared for whatever, which is difficult.
Let's get her ready to go to CT as soon as they're ready. You guys ready for scan?
Yes, we are ready.
So she's got significant chest injuries. You just need to find out exactly what.
Orthopaedic registrar Chris Lawrence is on duty as one of the trauma centre specialists available around the clock. He's been assessing Matthew's CT scans. Matthew's mum has also arrived and is waiting to hear about his injuries.
I'm going to take this blocks off because the CT scan has been clear of your neck, which is good.
Right, happy?
Yep.
The scan has also cleared Matthew's pelvis, but it's revealed a new injury.
This is the chin, and you can see the jaw is in multiple pieces. If we come up slowly, you can see more pieces appear where his jaw has been shattered at the lower border.
Matthew's jaw has taken the force of the impact.
He doesn't have any serious injury in the brain. Although it's very unpleasant and must be incredibly painful for him, it's actually serves as a bit of a crumple zone for the brain itself.
She's done it or not.
Matthew needs surgery tomorrow, but for now, none of his injuries are life-threatening. His girlfriend of 6 months, Saffron, has arrived. This is the first time she's met his mum.
But yeah, that's it. He must be feeling better. He's hungry.
He's more coherent than I thought he would be.
Yeah.
Definitely, yeah.
Certainly more than I thought he would be.
Yeah, from the
the
way
way
we
got
were brought in.
I
Yeah,
thought-
it was quite horrendous, yeah. I was at home and 2 police officers landed on my doorstep. So immediately you know there's something wrong.
I absolutely assumed that he had already died.
Rod prepares the next step in Teresa's chain of survival at the critical care unit.
Right, so a lady who's very sick is in scan now. I'd like her to come from scan to here.
Yeah.
Is that all right?
Yeah.
So she's got a big pulmonary contusions, lots of fractures. So she's definitely coming to you, and I'd like her to come from scan.
The scan shows that Teresa has broken ribs on both sides, and the accident's left her lungs badly cut and bruised.
So she's now moving to the critical care unit, where she's going to be kept on a breathing machine to allow her lungs some chance to recover from this injury. And that's going to take a little while, so she's going to be kept asleep for a while, and she's going to need to be sedated in order to be able to tolerate the breathing machines for over the next few days.
While the staff in critical care monitor Teresa, her husband's been told that he's the only family member who hasn't been seriously hurt.
Oh dear, oh dear.
I've seen everything. I've handled every conceivable combination of injury, from assaults and murders through to war injuries. The incidents I struggle with most are road traffic collisions, usually involving family groups. Family groups that are torn apart in a single instant are what I struggle to reconcile in my mind.
Mom's in intensive care. Is she okay?
The nurse, well, the doctor down there, has sat down and gone right through everything and what their concerns were and what they found.
Okay.
In the moment, we're just keeping her comfortable while sedating her and doing the rest.
How's Dad?
He's sitting up. Obviously worried about Mum.
Because they couldn't get to him in the car.
You could just stop me off.
Thank you. Just don't keep anything from me. Okay? Thank you. Just don't keep anything from me.
It's a Thursday afternoon.
Hello, Adam Brooks Major Trauma Centre.
In the emergency department, Dr. Tom Larson gets a warning of a possible major trauma.
99. Okay, fine. And your ETA is about 10 minutes. Fine. Okay. I've just been grabbed from minor injuries. Apparently there's a 24-year-old lady been driving a car apparently without a seatbelt and run into a wall.
The patient's name is Lauren.
Got straps.
After driving through a brick wall at 50 miles an hour, she managed to phone her parents for help.
Apparently she skidded on something in the road, lost control of the car. It ended up spinning 360 degrees, and then she ended up in someone's front garden, crashed into the wall, which is no more. It could have been a lot worse, could have been much worse.
Just let me know if anywhere that I touch in your tummy causes you any... Just up there, yeah?
Even though Lauren seems stable, Tom knows the force of her impact means a complete assessment is vital.
How would you rate your pain at the minute if 10 out of 10 is the worst pain you could imagine?
8.
Pain in her head, pain in her chest, and tenderness in her abdomen, so potentially quite a few sites of injury. The initial look at the scan, there seems to be some bleeding in the abdomen, so just looking for what might be causing that.
The spleen's completely gone.
So you get from the spleen, do you? Yeah.
Completely lacerated spleen.
Okay. So quite a few things to do now. I just need to get her various injuries sorted out. I'm going to call the general surgeon.
The result of the CT triggers a full major trauma response. A shattered spleen can cause sudden massive bleeding.
Within the Major Trauma Centre, we have a dedicated major trauma emergency theatre and operating theatre available 24 hours a day.
So what we need to decide, basically, is a plan of attack.
Dr. Iram Amin has arrived from the emergency trauma theatre.
Quite a fairly significant injury, I think. So there's quite a lot of free fluid there. You've got a fairly significant injury to your spleen. If it wasn't as significant, there was potentially a chance that you cannot operate. But I think with the degree of injury that you've got, we do need to do an operation and to remove your spleen. I can understand it's all very scary and all quite a lot to take in, but I think from our point of view, it's quite important we get you to theatre fairly quickly.
Lauren's taken straight to surgery.
Right, arms out. Good normal position. We need to get on with it. Some people, they have a big injury to the spleen, they're bleeding, they seem well for a while, and then suddenly they go off a precipice and become very unwell indeed. Hi there.
Hello.
Is your name Harry's?
Yes.
Richard Hardwick's my name. Hi.
Hello.
Consultant surgeon. If your spleen's salvageable, we'll save it, but it often isn't in this situation, so you may end up without it. The clock is ticking, so it is a relatively tense time with any trauma. And now the important thing is that we keep moving. Right, let's see what the damage is.
Richard first needs to take a close look at the state of Lauren's spleen.
It's a very clever organ. Yeah, filters your blood and takes out all sorts of things, like old red blood cells. Just put your fingers there. It's an important part of your immune system. And we try, if we can, to save it. In trauma,
if Richard does remove the spleen, Lauren will have to take antibiotics every day for the next 5 years to protect herself against infection.
So I'm going to mobilise the spleen, have a look at the back. It's just conceivable we might end up being able to save this.
It's horrible. Sitting here waiting is horrible. But no one can tell us anything because they don't know until they've done it, do they? So it's not nice.
Sitting here with our fingers crossed now.
It's 5 minutes on the clock, but when you're sitting here waiting for news, it might as well be an hour. It's awful.
Now, interestingly, just fresh blood starting to ooze through the clot, which suggests that there's a deeper injury, and that would fit with a CT scan. Mash that good and proper. I have a feeling this is now starting to look much less likely to be saved. Yeah, this is the swab that I put in coming out. There's lots of blood in it, so it's clearly bleeding posteriorly, and it's not salvageable, this spleen, so we're going to take it out. Scissors, please. Gently, gently, easy, easy, easy. Yeah. Okay. Bucket. Thank you. Right, let's have some string to tie these off.
Less than 4 hours after arriving at the emergency department, Lauren's life-saving operation is complete.
We want to try and get her up, sitting out of bed, moving around tomorrow. We want to stand her up and get her moving. We don't want her lying in bed for a week. That's a recipe for disaster. Richard Hardwick, consultant surgeon. Nice to meet you.
Hello.
Hello. Hi. She's fine. It wasn't salvageable. We couldn't save it, so she's lost her spleen.
She's going to be all right.
She'll be fine. She'll be fine.
Oh, God.
But without her spleen. So.
And that's.
You can live a perfectly normal life without a spleen. She's going to have some antibiotics for a while.
She's all right, and I'm so glad. She could have gone through the window screen. She could have been killed. So, small price to pay. Thank God.
Lauren will be able to leave hospital in a week, and she should be fully healed in 3 months. It's a day since the Davis family were cut out of their car. Teresa is being kept sedated on the critical care unit. A breathing machine is keeping her alive and giving her damaged lungs a chance of recovery.
Mum's the centre of the family. She has the purest and kindest heart of anyone I've ever known. I've known a few people. You know, she's just unique.
Well, it's difficult in any situation to go into A&E with one relative, but try and split yourself between three and not knowing what's going on. And
when they brought Mum in, my mum was just, they wouldn't let me near her. And I just thought she'd gone at that point.
So this is just oxygen. As I say, might smell a little bit rubbery. Well done.
Teresa's daughter, Dawn, is having her broken leg fixed. Matthew, the driver from the other car, is also about to be operated on.
I don't even remember what happened. I don't even remember if I was like overtaking, like being overtaken, put my brakes on, hit a corner, whatever. So, you know, without knowing that, I could have been worse. I could have been dead.
2 different surgical teams are going to operate on Matthew at once.
So here you can see a fairly simple sort of fracture through the shaft of the thigh bone. And our aim is to put a rod down the centre, having reduced the fracture.
While orthopaedic registrar Henry Budd pins the leg,
Ready, steady, slide.
facial surgeon Malcolm Cameron will work on the shattered jaw.
The important and painful part for him is his fractured lower jaw, which you can see here on the left side at the front. My intention is to open up the fracture and put 2 metal plates onto his lower jaw to bring it into the correct position. The metal plates will sit on the front of his jaw, and then opening and closing will be normal afterwards. However, he won't be chewing a normal diet for 6 weeks. He'll be on a soft diet, soft, sloppy diet for 6 weeks.
This double operation reduces the time Matthew must spend under general anaesthetic.
There's the loose tooth out of the jaw. 6mm screws loaded up.
Malcolm will fasten the 2 halves of Matthew's jaw together using titanium plates.
It's effectively now a custom-made, specially bent plate, 8 holes long to cover the extent of this fracture.
With several loose pieces of bone in the chin, Matthew needs the long plate to join together the shattered area.
The trouble is we have to adapt the Meccano to fit the injury.
The entire operation is being done through a cut below Matthew's gum to avoid any scarring to his face.
And importantly, I'm trying to keep it underneath this nerve. And I'm trying to put the plate underneath that nerve so that nerve is retained so he doesn't end up with a numb lower lip. Another 6mm screw, please. Good wash of the hole there. It's not the easiest fracture in the world to have fixed for a mandible, but it's gone very well, and we've got a nice reduction and it's nicely fixed. It's very firm now. He's a young, fit, healthy man, and his jaw will heal normally afterwards.
Matthew should be able to use his jaw to chew again in 6 weeks. And with a metal rod in his thigh bone, he should be up on crutches in a fortnight.
Very good.
In the year ending June 2012, just under 1,800 people were killed in the United Kingdom in road traffic collisions, and just under 25,000 people were killed and seriously injured combined. That's 25,000 people. I'm an emergency physician because when I was having a driving lesson at age 17, there was a head-on collision in front of me. That was my first exposure to multiply injured, trapped people, and I felt completely helpless.
073, go ahead. We have 3 patients. One is P1, probably going to be RSI'd. Second one is P2.
There's been a serious 3-car accident on a B road, 55 miles west of Cambridge. The emergency department have received early warning.
There's been a big accident. There's been several people who've been ejected from the vehicles as well, which has suggested a quite significant mechanism of injury.
An emergency medical team brings in a female patient direct from the scene. She's 37 years old, and her name is Dion.
So this was rather a nasty 3-car road traffic collision. It was a very nasty scene, so one of the cars was being towed by another car, and both of those managed to somehow go head-on into another vehicle.
This is Dion. They're involved in a head-on collision with another vehicle, so 3 vehicles involved in total.
One of the ejected patients was pronounced life extinct at the scene.
Any pain in your tummy at all?
Fracture 100%.
Hemoglobin amplification is stable. Potentially got a fracture for lower leg. Okay, so we've organised a CT scan, and we're now waiting to get a CT scan.
So looking through first on the arterial phase, we can see there's some bruising in the skin, but we're really looking to see if there's any arterial injury. And this is all looking fine. So we've dealt with the life-threatening, and then we move on to any of the other injuries. So has she broken her foot or her hands?
We know from the scene of the accident, from the paramedics and doctors at the scene, that there is one deceased patient. And we do believe it's the partner of the lady that we're currently treating.
Ian Gray, I'm with the traffic police at Cambridgeshire. So I do have to tell you some bad news. The person driving the red Polo, which I believe was doing towing, unfortunately didn't make it as a result of the accident. Has died of his injuries.
That's
okay.
He's my partner.
Okay. Would that have been Paul?
Yeah.
Okay. Very sorry to have to tell you, but unfortunately he didn't make it and he died as a result of the accident.
Sure I can't get you any painkillers, or is it okay at the moment?
Oh, yeah, I'm alright at the moment, thank you. Just achy, but it's not drastic.
So I'm going to have a chat with the nurse in charge and see if there's any beds upstairs. So it'll be a lot quieter than down here. Is that all right?
Yeah, yeah. Don't seem real, really.
Two days after her accident, Teresa is still on a breathing machine in the critical care unit. But the doctors are reducing her sedation.
I heard from my son that my wife is waking up. So. It's a small mistake. all I can hope that she comes through this as well as I do in the end.
Teresa, I think your husband's coming down to see you.
John and Teresa have been married for 45 years. They haven't seen each other since being cut out of their car.
Oh, yeah. Hello.
Looking after you? They're looking after me. How are you feeling? Okay. And be careful with that hand, you've broken it. Yes. You want to write on a piece of paper? Here it is. No, there's no way on earth you're going to get rid of me. You still haven't run the licence out on your marriage certificate, Chris. Okay? Got a few years to go yet. We're all three here. All three of us. No problems, we're all three here. Family's no smaller than it was the other day. Okay? And I love you too as well, sweetheart.
Matthew's condition has got worse. The operations on his leg and jaw have taken their toll.
When you have a life-threatening injury, you can think of that as the first hit. Some people need extensive surgery, and that, from the perspective of the body, is like a second hit. It's like having another accident, almost. Matthew had this operation done, and you can see that the orthopedic team have inserted this stabilizing rod through the center of his thigh bone, and that releases into the bloodstream marrow and things that get filtered by the lungs, and in some cases that can contribute to the development of lung problems after this sort of operation.
He'd had a scan which showed up the pneumonia, because his lungs aren't working well enough because of the pneumonia, they said, so he needs higher oxygen levels.
This picture is consistent with pneumonia. This is quite a serious problem. It can be life-threatening.
Doctors move Matthew to the critical care unit as he deteriorates. The pneumonia is clogging up his lungs, stopping them from absorbing enough oxygen.
When you've got this sort of problem, you need support, you need ventilatory support, and it kind of pushes air in every time you take a breath, and that mask can be really uncomfortable for people at the best of times, let alone if you've got a broken jaw.
Dion is recovering on a ward. It's 2 days since the collision that killed her partner.
I just remember a car. I could see the man's face, and it was just pure fear and panic, and then there was just a big bang, really. And then the police officer came to see me, and he just said that the person in the Volkswagen Polo hadn't survived. And I knew that was Paul's car. And they said it must have been very instant, so he didn't suffer at all, from what we can gather. Paul was only 46, and now 5 kids. I haven't got their dad anymore.
It's 4 days since Teresa's collision, and she's made a huge step forward. The tubes have been removed from her throat, and she's breathing for herself once again.
I've got to get this right. I think it's 6 ribs on that side, 4 on this one. I think that's right. I thought I was going to die when I blacked out. I'd gotten deaf. I couldn't see very well, and everything, this black curtain came down. I can't quite believe how well I am feeling. Just have this problem with my chest.
As Teresa slowly improves, the critical care doctors want to find out if her lungs have healed enough to move her onto a rehab ward.
John is a great Star Trek fan, so I'm quite used to seeing lots of the technology in Star Trek episodes.
Breathe normally.
I just want to know the result now.
Teresa's breathing for herself now. She's starting to recover. This CT scan, which now we're over a week after the injury, is showing that her lungs are recovering and things are looking good. There's no suggestion that she's developing any serious long-term complications from this injury.
On a ward at the other end of the hospital, Teresa's daughter Dawn is also recovering well.
I'm going to see my daughter. She has no idea.
Surprise. Surprise.
Well, I didn't expect to be out of bed today. And I thought the first step would be to sit on the edge of the bed, but I've actually got up and out.
You don't do this too often, I'll tell you.
No.
Oh, I can't get out of bed to get to you. No, I won't. Oh, wow. Oh, wow. Oh, I can't go fast enough.
The bed's big enough.
Hello.
How's the breathing feeling, though? Can you give me a big cough?
On the critical care unit, doctors have kept Matthew on high levels of oxygen for 2 days, and he's winning his fight against pneumonia.
Do I have bruising in my lungs? Very bad. But if your breathing seems very good, so the fact that you're able to talk in full sentences is a good thing. So lots of things to be cheerful about.
I've never been anything close to this position, you know, and first you're getting your bearings, and then you're starting to realise that things are pretty serious. You're starting to think, you know, am I gonna make it? But I survived it, you know what I mean? And, you know, I'm still here.
Go on, Shannon, after you. It's gonna be like a mom and daughter race.
Less than 2 weeks after their collision, all 4 patients are well on their way to recovery.
As recently as 6 months ago, we wouldn't necessarily have been able to handle 4 simultaneous patients at once in the emergency department in the way that we did. I'm obviously not pleased that they had the injury event in the first place, but I'm really pleased that the system is working.
Yeah, but that's like amazing. Literally 2 days ago, you were, you know, struggling to. Well, you couldn't move your feet, could you?
I'm having a bit of a competition with the Grim Reaper, and if I can snatch someone from the Grim Reaper and we can save a life, then actually that's hugely rewarding. That's hugely, hugely rewarding for the whole team.
The Davises are holding a family gathering, the first since a collision almost 2 months ago.
Looking back on it now, it was definitely a very crazy time, and the relief of being here today, now, and everybody home, back in one place, it's just brilliant. They're okay, they're alive. What more could you ask for?
This looks nice. Oh, Gary. He's got a T-Rex in his bedroom window. It's a dog.
I just couldn't imagine this family being without them in it. It just wouldn't be right.
Sausage? I mean, it could have been so much worse. Where's your knife? Did you forget it? Ah! It really does make you think, you know, that life can change in a second. And life is precious. It is.
Squeeze in. Head on the edge.
It's drawn us closer together as a family, and that is possible even when you're close, because then it's quite obvious to everybody that we're all mortal.
Squeeze!
Oh, that one instead. It's never going to be forgotten. It's going to be there for the rest of our lives.
Tell me if I'm squeezing you too hard.
No, you're not.